Hi, I'm Dr. O'Shaughnessy. I'm one of the reproductive endocrinologists at Conception's Reproductive Associates. So when a couple comes in, we actually do a workup that involves both of them. So obviously it takes two people to conceive. Most of the workup generally is with the female. A female workup is going to be a little bit more complicated because we actually tailor the workup to the history we get from the female. So there is a basic workup for a female that comes in, doesn't seem to have any issues in her history that would lead to infertility. Whereas if a female comes in and she has, for example, a history of recurrent pregnancy loss, or a history of having had infections in the past or surgeries in the past, then things may be a little bit more complicated with the workup. So we want to look at her ovarian reserve. Ovarian reserve basically means where she sits in a bell curve according to her age as to the number of eggs that she has in her ovaries. As we know, women have a certain number of eggs. New eggs are not formed during a woman's lifetime. We are born with a certain number, and that number goes down as we get older. So we want to know, does, say, a 32-year-old woman who comes in, does she sit in the middle of the bell curve, or is she on the high end in terms of egg number or the low end? So one is to do an ultrasound, and the ultrasound we generally want to do in the beginning of the cycle, right when she has her period, because that's when the ovaries should be nice and quiet. There are no follicles that are growing or cysts on the ovaries. That's accomplished by doing what we call a transvaginal ultrasound. It's a probe that goes in the vagina. We're able to see the ovaries much more clearly than doing an ultrasound transabdominally through the abdomen. And so that makes it easier for us to see the ovary and count the small follicles. And the follicles that we count are usually less than 10 millimeters in size. Those are called antral follicles. And interestingly, those are the follicles that have been recruited for that cycle, meaning these are follicles that are out of that cohort, one will be chosen for the dominant follicle or the dominant egg that's going to ovulate. Why is this important? Is because that number reflects the total number in the ovary. So that's called a resting follicle count or an antral follicle count. That number again is related to age. So the older you are, that number is going to go down. And again, there's a bell curve for that. There's normal values for women at different ages. When we do the ultrasound, the baseline ultrasound, we look at the uterus, make sure that there are no structures within the uterus that would be worrisome, like fibroids or polyps. We want to see the size of the uterus and the shape of the uterus. Is AMH, which is anti-Müllerian hormone. The anti-Müllerian hormone is a hormone that is actually secreted by cells that line the follicle. The follicle, again, is just the cyst that holds the egg. Obviously, the more follicles you have, the more of these cells, the granulosa cells you have, and the higher your AMH level. The higher your ovarian reserve number, the higher your AMH number. What's nice about AMH is that you can measure it anytime. It doesn't change throughout the menstrual cycle. It should be pretty steady. Again, it does go down as you get older, but it's not. The baseline levels are estrogen and FSH and LH. These are hormones that are produced in the brain that control ovarian function. These levels should be done on the second or third day, possibly the fourth day of your menstrual cycle. These levels will change throughout the menstrual cycle, and we get more information, obviously more important information, at the very beginning of the cycle, because that's when those levels should be nice and low. Follicle stimulating hormone is important for egg development. In the beginning of the cycle, the FSH level will be nice and low, but as the cycle goes on, the FSH level will start to rise in order to allow for the development of a follicle. Once your estrogen level starts to rise, that FSH level will then drop. So as you can see, there's a cyclicity to that FSH level, and that's why it's so important to measure it at a very specific time to give us that information that we need. If we see that the estrogen level is high or that the FSH level is high, follicle stimulating hormone, then that may indicate a diminished ovarian reserve or low ovarian reserve. Women who go through menopause will have high FSH levels and have high LH level, luteinizing hormone levels. So that's a complete workup for ovarian reserve.